Hey everyone, Dr. Brittney here, and I have the little one here too, so I know it's dark, but she just got done eating, so she's kind of in a milk coma, so I am just resting here. I'm in the office today just kind of hanging out, but I wanted to hop on here because I have had quite a few of my mamas asking me questions about adjusting little ones, and not only adjusting little ones, but I've had the question of, oh my goodness, you adjust babies. Why in the world would a baby need to be adjusted? And the other question that I get a lot is, how soon do you adjust babies after they're born? And so I just wanted to hop on and kind of address some of those questions with you guys and explain to you why and when we do all that. So the first thing that I want to say is, birth can be traumatic for those little ones, period. We as mamas go through birth and delivery, and we see and feel what happens to us, but we don't always associate that with what those babies have gone through. Now, it is hard on us mamas, but think about what those babies have to go through to get out. They have just as much, if not more, trauma and space to get through that they have to move and shift through. So they go through just the same thing that we do during that delivery. So kind of keep that in the back of your mind. And dads or boyfriends or anyone who has been in that delivery room, think about what your significant other has gone through when you see them, just because that's something to pay attention to. But just some facts that I wanted to kind of share with you guys is that, an infant's spine will double in size in the first 2 years of its life. So that is a lot of growing and a lot of changing that happens in those first 2 years to that infant's spine. And we got some movement here, we'll see. So the spine protects that nervous system that we always talk about, and the nervous system is made up of the brain, the spinal cord, and those spinal nerves. And so, that nervous system is what is responsible for your baby's immune system, their digestion, their elimination, and their respiratory function, along with so many other things and functions that the body does. And so those structures need to develop properly in order to promote the best health and function as that baby is growing up into a toddler and through life. So let's talk about some kind of traumas or stressors that can cause that subluxation or that stress to that nervous system, and what some of those possible symptoms could be. Because again, this is something that we want to make sure that everyone's aware of, because people aren't always aware of them. So I'm just going to kind of list off some of those trauma stressors that can cause those subluxations. Okay, so the first one, like I already mentioned, is birth. We had a wonderful delivery with Chet. I know that you guys have heard Dr. Brian and I both talk about it. It was a beautiful water delivery, but he did have that cord around his neck. So that was a lot of stress on that upper neck area as he was coming out. Anyway, now just in birth alone, those babies will have 60 to 80 pounds of pressure on their head and neck coming out. That is a ton of weight and pressure on that little baby's head and neck, which is such a vital spot for them. So keep that in mind, and that's without any interventions. Now, when we throw in interventions, whether it be a forceps, a C-section, especially C-section babies, we see a lot of issues with them. But we see the like I said, forceps, or even sometimes doctors just trying to help get baby out, they use that head and neck as leverage. And so that can be really, really stressful and traumatic for those babies. But another one is diaper changes. We don't think about that one often, but you're lifting that baby up, and we're not always putting that baby's spine and that baby in a great position. They're laying flat, which is not a normal spot for their spine to be in. They need to have that nice forward curve. That's the way that fetal position is designed, and we lay them out flat for those diaper changes, so that can definitely cause some of those subluxations. Lifting and carrying. When we're carrying these babies, we don't always pick them up in the best manner, and that can cause some issues. Or carriers. There's a ton of terrible carriers out there that put babies body into a really bad position again, and so that can definitely cause some of those subluxations. Another one is car seats. I'm seeing this a lot more, that she is in a car seat so much more than what Chet was, and it's just because life happens. Number 2 has to just kind of fall into place with life, and so they're in the car seat a lot more. Vaccines, we're not going to talk about that right now, but there are definitely toxins that will go into babies' bodies, and anytime that there are toxins, that causes stress on that little nervous system. Swings and different carriers that babies can lay in, any of that can cause stress, because again, it's putting them into an unnatural position and it's not helping those curves to develop. Formula, again, there's toxins and things that body isn't used to handling and isn't designed just for them. Another one is cry it out. There's a ton of research that is now coming out about how it's actually changing the neurology of the brain when we do cry it out with babies. And so again, I'm not going to get into that right now, but definitely do your research, and I'm happy to talk about that more if anyone wants to comment below. I am happy to chat with anyone about that. Another one is just overstimulation, period. So we don't realize that these little babies have not had any stimulation other than mama for the past 9-10 months, and all of a sudden they come out into this beautiful, bright world that is overwhelming to them, and that can cause a lot of stress and a lot of anxiety to these little ones, and we don't always pick up on that. So that's definitely something that is a stressor that can cause some of those subluxations in these little ones. So again, there's so many more, but I just wanted to throw some of those out there because those are the big ones. Let's talk about some symptoms now that we can get from that. Now, there's a ton of symptoms, but these are kind of the big ones that we see in our office. So colic is a huge one. So often we hear parents say, oh, I have a colicky baby, it's just normal, and here's the thing, is it's not. There's something that's going on with that baby, with that nervous system, that they're stressed out, that they need something taken care of because they're not functioning at the best optimal level that they can. Colic is not normal. So I just hope that you parents out there that are watching this just realize that, because that's what we're here for, is to help and guide and educate you guys and to help those little ones get in a better spot. Reflex, another big, huge one. I see so many of these little ones coming in here and they're already on meds for reflex, and it's just crazy. I mean, that's so hard on their nervous system and their bodies. Let's take care of it naturally. Eczema or different rashes, we see a ton of, and again, it's just making sure that nervous system is working and functioning properly, and making sure that they're clear of those subluxations. Ear infections, poor sleep, constipation, torticollis, plagioceph, which is flattening of the head on one side or the other, front, back, or just unevenness in that brain, or not brain, but the head and skull. We see a ton of that with our babies that have had interventions, but not just those intervention babies. Any baby can have that, especially if they have that tightness around the head and neck from coming out of mama with all that pressure that we talked about. Another one is asymmetric crawling. So this is a big one that a lot of people don't realize is something that can affect those little ones. A lot of times we hear parents say, oh, they just bear crawl, or oh, they use one foot and they crawl with one knee, and that's not normal. That's not good, actually. We're not making the proper brain connections then, so we need to make sure that they're actually doing the proper crawl pattern, and if they're not, that's showing us that there's some sort of disconnect, some sort of stress in that nervous system that we need to get taken care of. And the last one is just any infections, whether it be a chest infection or, colds, any of that stuff. So that's definitely something that we see in these little ones. And so people ask, again, I'm going to go back to kind of that first question, but when do we get those babies adjusted? And I say as soon as possible. We adjusted Chet right away after he was born, and he was about a day old when we first adjusted him. And this one, she got adjusted in the birth center while we were there. Her delivery was so much faster than Chet's. It was 4 hours start to finish, and a lot of people think that's, oh my gosh, that's so great because it was nice and fast, but birth is designed to do a lot of things for that baby. And when mama doesn't get a push as many times, it prevents some of the brain and the head from molding like it needs to, so it can cause some respiratory issues, because when those contractions are going on and mama is pushing and baby is in birth canal, it actually is kicking on some of those respiratory centers in the brain. And so when we don't get a push as much as mama, it can prevent some of that. So we wanted to make sure that she got adjusted and had that nervous system functioning at the highest level that she possibly could right away. And so, you know, even though we didn't have a bunch of interventions, we still want to make sure that our kids are set up for the best kind of possible outcome that they can have. And so it's really important for us to realize that even though they are really tiny and sometimes it may seem scary, for me as a mom personally, it's more scary for me to think about my kids not growing up with the most potential that they could have, and for me to realize and know that I could have prevented some of the illnesses or the sicknesses or the issues that we struggle with as parents, such as sleep and things like that, colic, all of those things that could be prevented if we just get that nervous system functioning at the best way possible. So I encourage you guys, like I said, to drop comments below, ask me questions about all of it, because that's what we're here for. You know, adjusting a little infant is so much different than adjustments on older people and even our toddlers. So 99% of the time our babies just sleep right through the adjustments, but if they don't, it's really neat because you can see how their neurology responds. It is just amazing to watch because their body is set up and designed to do it. You know, God put them together perfectly, and so why not just tap into that God-given potential so that they are set up for the best functioning and the best way that they can grow up. So I know that this gets long. My videos always go long, but I hope that that answered some questions for you guys. We do adjust babies right away, and it just sets them up for the best future possible, and we love seeing those little ones. So I hope that you guys have a wonderful afternoon. She clearly is, you know, doing good, just chilling, relaxing. But it was so good to talk to you guys and see you again. I know it's been a little bit, but I will hop on and do some more videos with you guys coming up soon. So have a good one. Bye, guys.